It's March 31st, 2023, about 10:15 in the morning. I'm Todd Dunn, and today is the 32nd day since my knee replacement surgery. Matter of fact, 32 days ago, right now, I was right at the end of the actual surgery and just about ready to be moved out into the recovery room. Now, as you saw in a little intro clip, I have made a lot of progress. That was me 2 minutes ago walking up a flight of stairs. Now, I can go down the stairs normally, like step over step, although I do still like to keep my hands on the railing. But I can come up the stairs completely normally without touching the railings. So things are going pretty well, and actually I think my ability to do stairs is partly due to the fact that I live in a 3-story house, and ever since day one I have had to go up and down stairs every day. Now, I started out stepping up with the good leg and down with the bad leg, like they tell you in their first physical therapy sessions. But within about 10 days, I started leading with the bad leg going up. And it took about another week or so before I could start leading with the good leg going down, although I had a lot of weight on the railings. But now I'm almost to the point where I can go down the stairs without touching the railings, which is a big plus for me. Anyway, what I wanted to do in this video is talk a little bit about my first month of recovery after the surgery. And I'm also going to talk a little bit about the surgery itself and what happened in the hospital. I know this is in my early videos, but I thought I'd pull it all together in this video. And I'm probably going to split this into 2 videos simply because of the length of it, because there's a lot of ground to cover. Anyway, this whole thing started about 10 years ago when I was working on my boat and I was down inside a cockpit locker in a very awkward position. I had myself braced up and my right foot slipped. And it slid down underneath me on the slope of the hull, and I bent my knee to the left side. Now, I can assure you knees don't like that, and I messed up my knee pretty good. But back then, I was being tough, and I only had very high deductible health insurance, so I did not go to the doctor. I just toughed it out. And I limped around for over a year and basically did very little walking. And then over the next 10 years, I gradually improved until about a year ago, my knee started hurting quite a lot and I walked less and less since every step hurt. And finally, in December of 2022, I said, oh, heck with it. And I went to my family doctor and I said, I need to have an evaluation done of my right knee. It really hurts all the time when I'm walking, and I need to get something done, whatever it takes. Maybe just a shot into the joint to make it feel better, whatever. So they sent me in for x-rays, and then once the x-rays came back, they showed some abnormalities that I didn't really understand at the time because the doctor simply read me the x-ray report, which didn't mean much to me. I'm not very big on orthopedic lingo. So he sent me to an orthopedic surgeon on a referral. So I went over. The orthopedic surgeon had my x-rays and asked if I had seen them. I said no. So he showed them to me and pointed out that there was no cartilage in my knee. There should have been a black space between the shin bone and the thigh bone, and there was nothing. The bones were in contact. And I asked him what that meant, and he said, "You need a knee replacement." And I said, "Well, can't we just, put some shots into the joint?" And he said, "That won't do any good with no cartilage." So I asked if I could think about it for a while, went home, talked to my wife, and called his office back up later that day and said, "Okay, let's do it." And they scheduled my surgery for the end of February. Now, I started thinking about the surgery as soon as it was scheduled, and decided to see if I could find out a little bit about the surgery. So I looked on YouTube. There are tons of videos by orthopedic surgeons and physical therapists about total knee replacement surgery. It's a very popular subject. So I looked into it, and pretty much everything I read or saw said, this is the most painful surgery you can have, which wasn't a positive thing. Now, I personally think they were wrong, but anyway, but there is still pain. I mean, right now, I'm sitting here with my knee bent a bit more than 90 degrees, and there is, I guess some people would call it pain. I call it tightness in the knee, but it's there. And that's after 4.5 weeks. So, I guess the painful description of it comes from the fact that pain at some level does persist for quite a while. So anyway, another thing I discovered in reading and watching videos was that one of the best things you can do before surgery is to work on your strength and range of motion in your knee. And in fact, they recommend doing the same exercises you'll be doing after knee surgery before the surgery. So I started doing that. Isometrics, walking as much as I could tolerate, and walking stairs. I hadn't been walking stairs normally for a couple of years because of the knee pains, but I started doing it. It was really unpleasant. I could go up the stairs normally. Down, I really could almost not do it, but I forced myself, even though it hurt a lot, and strengthened my knee as much as possible. And I also worked on flexure to get it to bend as much as I could before the surgery. And I think that helped a lot. And I'll get to that in a little bit. So, surgery day approached. One of the things they tell you before going in for this, what is considered a fairly major surgery, is don't eat anything or drink anything from 10 p.m. or so the night before surgery if you have a morning surgery, bedtime if you have an afternoon surgery. So I went one up on that. I switched to a liquid diet the day before surgery and basically just drank apple juice that day and a little coffee. And that was it. And I'm glad I did that, because one of the things that happened as a consequence of the surgery, and I think the type of anesthesia I had, was that I was really constipated for like 3 days after surgery. And if I had been eating a lot, that could have been very uncomfortable. But because I had kind of prepped my system to not have a lot of solids in it, it really made it less uncomfortable. Still wasn't pleasant. So anyway, then surgery day arrived. Got up, wiped my leg down with the antiseptic wipes that they gave me, drove into the hospital, and changed into the hospital gown and wiped my leg down again, and went over. They put the IV in my arm to administer drugs during the surgery, and shaved my leg. Actually, the surgeon came around and he actually shaved my leg. And one thing that they did multiple times, everybody who talked to me said, "Which leg are we operating on today?" And so I kept saying, right leg, right leg, right leg. And of course they do that because they don't want to operate on the wrong leg. And so they made sure that was there, and the surgeon finally sort of autographed my knee just above the where he was going to make the incision with a marker after he confirmed that it was the right leg. And the surgeon shaved my leg where the incision would be with a little electric clipper. And then they wheeled me into the operating room, and I had opted to have a spinal anesthetic where they actually made an injection into my lower spine of anesthetic that deadened me about from the belly button down. And I think that's one of the big factors in the constipation, because it not only deadened me so I couldn't feel anything, it made the muscles so I couldn't use them. They didn't work. And I think since a lot of your intestinal tract is below your belly button, it basically turned my intestinal tract off for the period that the spinal was working. Spinal was a little uncomfortable, but not painful having it done. Then I laid down on the hospital gurney, and they got me ready for the final procedure, and they put me to sleep. Now, they gave me the option of staying awake during the surgery and told me I could watch it on a monitor. I opted not to do that. So they put me to sleep, but it was a sort of minimal sedation. I was asleep, no sensation from the waist down, and but I was breathing on my own, which was a big plus. And next thing I knew, surgery was over, and I was waking up in the recovery room. And I had no after effects from the sleep induction part of the anesthesia. I still couldn't really move my toes or anything yet. The spinal had not worn off completely. And the next thing they did while the spinal was still in effect is they put a nerve block in just above the operative site on my knee, which basically means that they injected anesthetic on either side of the principal nerve in my leg, which further deadened my leg as far as pain was concerned. And that was a really nice thing. Because the spinal anesthetic was still going on, I could watch them doing it, but I didn't feel anything. And which is good, because the needle they used seemed like it was about that long. They really worked it in there using an ultrasound probe to get it in the right place and not, hit any arteries or anything like that. And took a while, but they did it. And then they took me over to my hospital room, where I continued my recovery. And the biggest problem after I got back to my hospital room was that I got there a little bit after noon. And I had missed the normal lunch service. So I was lying there, not having eaten anything except apple juice for 2 days. I was really hungry. And I finally mentioned to the nurse, "Am I getting lunch?" And they asked me if I felt any nausea or anything, and I said no. So they put in a special order for lunch, and 15 minutes later, they brought me my lunch. And I ate it. It was fine. It was a fettuccine alfredo and some soup. And everything was great. And I actually had some food in me, which felt really good. And then right after lunch, I had just sort of settled back down from eating my lunch. A physical therapist showed up. And physical therapist said, "Okay, let's get you out of bed and get you walking around." Now this was at about 2 o'clock, and I came out of surgery 10:30-ish. So 3.5 hours after I came out of surgery, they got me out of bed for the first time. And then we walked out into the hall using a walker. and walked up and down the hall a little bit. I was feeling a little bit lightheaded, and at that point the physical therapist decided it was time for me to get back into bed because the last thing they want me to do is fall down. I could have walked further. My knee was not bothering me. I was feeling zero pain, and I was able to, walk without any problem with the walker. And I actually tried to not use the walker or use it very little. I was just touching it with my fingertips for a while, and that felt pretty good. So after my walk, they put me back in bed, and I did feel a little discomfort in the kneecap, and the nurse gave me a 2 milligram IV dose of morphine, which completely eliminated that discomfort, and I went back to zero pain. And that was the only narcotic I had after surgery for 10 days. So then, I basically laid there in the hospital bed for the rest of the day. That evening, I tried watching television, which I don't normally do, and found that TV is pretty inane. I really couldn't find anything I could tolerate on television. So I had a book with me, I read for a while, and then I went to sleep. And during this whole time, they had my leg iced and elevated with one of these ice machines, which is basically a little tank that they put ice water in, and it circulates the water through a pad on your leg. And they circulated ice water through there the whole time I was in the hospital. And they had a gadget on my left leg that sequentially squeezed my leg starting at the ankle and going up to the knee to stimulate blood flow out of the leg so that I wouldn't get any blood clots. And so that was that. Next morning I woke up. I was waiting for breakfast when the physical therapist showed up again. And so I went and got up. Physical therapist said, well, you might be going home today. It depends on how well we do. And said, I understand your house has some stairs. I said, yes, it's a 3-floor house, so I have 2 flights of stairs, including a spiral staircase. So the physical therapist said, okay, we'll do some stairs. And we walked, again with the walker, although I was just pushing it with my fingertips, down to the other end of the hospital, and probably 50, 60 yards away to the stairwell. I had thought they were going to take me down to the physical therapy room in the elevator and have me go up their little 3-step flight of stairs. Nope. We got to the stairwell in the hospital and they said, well, you've got 2 flights of stairs, so let's go down 2 flights. So I went down 2 flights of stairs and turned around and came back up 2 flights of stairs. I was pretty wasted by the time I got back up there. My knee didn't hurt, but because of the nerve block and everything. But I was feeling a little bit out of it. And we walked back to my room and I got back in bed. And at that point, I was still waiting for breakfast. This happened like at 7 o'clock in the morning. Somebody showed up from the lab and took a blood sample. And they processed that, and fairly quickly I found out the results. And the reason I had been feeling lightheaded was that I was really anemic. My hemoglobin had been over 16, which is sort of upper mid part of the normal range, going into surgery. But the day after surgery, it was down around 11, which is really quite anemic. And I was, basically my blood wasn't moving as much oxygen as it should have been, which led to me tiring very quickly. The drop in hemoglobin was a consequence of blood loss during surgery and bleeding after the surgery. They had a little drain attached to my leg with a reservoir that they changed periodically. And I probably lost around a liter, which was about 1/6 of my blood during and after the surgery. But they also had me on IV solutions the entire time, from the time I went into surgery until just before they released me from the hospital. And they pumped a lot of fluids into my blood system. And I think that in addition to blood loss, I also had some dilution of my blood. They kind of puffed up my veins and filled them up with saline solution and Ringer's lactate solution. So that diluted my blood and lowered my blood counts. So anyway, little after lunch, I had my breakfast then, and then after lunch, the surgeon came around, looked me over, bent my leg, and he said, "Okay, you're going home." And they called home, and my wife came and collected me. And when I left the hospital, the only things they told me about drugs for pain and for other things were, one, I would be on a blood thinner, 1 aspirin a day. Not exactly a big dose. And for pain, a mixture of ibuprofen and acetaminophen or Tylenol. And that was it. Nothing else. So I went home, and I was still, when I left the hospital, not in any pain. But later that afternoon, the nerve block started to wear off and things started to hurt a bit. But I was able to control it with the Tylenol and ibuprofen. And I was also, doing bending exercises and everything to try to, get my flexibility back up. And of course, I was walking around the house a little bit. I initially walked around the house with a walker, but that, because of the way our house is laid out, that was kind of inconvenient. So I started just pushing it ahead of me with my fingertips, and then finally said, heck with this. And late that day, I walked without it. And since then, I haven't used it. I just walked around the house normally. I was always within a step or so of something I could put my hand on, the back of the sofa, a railing, a counter, something like that. And I managed. I had anticipated that I would be sleeping in my chair the first couple of nights, but actually I managed to come up the spiral staircase and sleep in my bed. So that's the day of surgery and the day after. And things were going pretty well. I was managing my pain at home with over-the-counter drugs, and everything was going pretty well. Now, there are a couple of things I did before I went into hospital to make life easier. I'll show one of them to you now and describe the others. Now, one thing I did, because my bed is quite low, was I built these little supports to raise the bed about 5 inches. And that allowed the bed to be much easier to get into and out of. And I'll show you that right now. Now here I am. As you can see, I can easily sit down on the bed, and I can easily stand up out of the bed. Well, at first, I wasn't doing that, obviously. What I was doing was hanging on to something. I've got a walker right here by the bed, and I used it to hang on to and get down, and then rotate myself into the bed. Now, because I had strengthened my leg as much as I could before surgery, I was able to do that without having any assistance to lift my leg up, which I think was a big factor in my recovery. I also built a platform that I set my recliner chair on, which raised it about 2.5 inches, which made it much, much easier to get out of. And I when I built the platform, I put a board across the front so that the recliner chair couldn't tilt way forward and kind of pitch me out, which it had a tendency to do before, and which made it also easier to get out of. Because for the first few days after having the surgery, I couldn't bend my leg even 90 degrees. I could just barely get to 90 degrees. And when I started putting weight on it, it had a tendency to push my leg out in front of me and decrease the bend. So it was important to be able to, have the arms of the chair nice and stable so I could push myself up. The other thing I did was in the bathroom. I put in an 18-inch metal handrail on the wall so I would have something to hang on to when I was sitting down. And that was really important. Without that, it would have been quite a challenge to get in and out of that part of the bathroom. And I didn't have to worry about the shower for the first week or so because I wasn't supposed to shower. So anyway, that's the first day and a couple of changes I made in the house. Oh, I did one other thing. This was done quite a while before the surgery. I installed a railing on the opposite side from where the primary railing was on the main staircase up to the main, from the garage to the main part of the house. So I had railings on both sides. And I think that was important because, of course, you'd like to have a railing when you're initially going up to support your weight a little bit when you step up. And of course, when you're going the other way, going down, you want the railing on the other side of the stairs. So having railings on both sides really helped with that. So railings, handrails, and raising the bed and my recliner chair up a little to make them easier to get in and out of were significant factors in making life a little easier around the house. Now, there were some things that were still an issue, and I'll show you one of those right now. Okay, now here's a regular chair with no arms. These can be quite a challenge to get in and out of when you first come home from surgery. And I dealt with that by putting a walker next to this kind of chair and using it to support myself as I sat down without putting any significant load on the surgical leg. And similarly, used it to stand up, again with no load on the surgical leg. And that was necessary for, probably almost 2 weeks to do something, to have something to support myself when I sat down in a chair like this. Now, if you can, it would be advisable to get armchairs that have arms you can use to get up and down. But we don't always have those handy, and but you can make do with a walker or a cane or something like that to help you get in and out of these regular chairs. So when you first come home, your leg is going to be weak. You're not going to be able to bend it very much. And that's a function of, the weakness at least, is a function of how they do the surgery. They cut big incision, you can see it there on my leg. They peel back the skin and the muscles, and they cut through the muscles to expose the joint. And after they do the surgery, they stitch it all back up and close this incision up. But that's significant trauma to the muscles around your knee. And it takes a while for that trauma to heal. Mine is not completely healed, it's getting there. And it also takes a while to build the strength back that you need to be able to stand up or sit down in a chair like this without something like the walker. But after about 2.5 weeks, I was able to do that and sit down again without falling down into the chair. But don't figure on being able to do that when you first get home. Anyway, that sort of wraps up what I'm going to talk about in this video, which basically gets me through the end of my first day home and some of the challenges I had and how I dealt with them. And I'll start in the next video with my first night at home. And I'll talk about some of the challenges of sleeping and how to deal with that. Okay, thanks for watching.